Hi friends and family. I am attempting to videotape a video on how to take care of Landon, who has type 1 diabetes. Keep in mind that you're not expected to understand diabetes or to be able to manage Landon's diabetes on your own. We just really appreciate you as babysitters, as family, as friends caring for Landon to make sure that you can handle his diabetes while he is in your care. We are always just a phone call away, and you can also, in an emergency situation, always take Landon to the ER, even if you just don't know exactly what to do. Err on the side of caution. But keep in mind that type 1 diabetes is not this horrible diagnosis that some people think it is. Landon is perfectly healthy, and he'll stay healthy as long as he gets insulin and takes the correct number of carbs. He's not going to just all of a sudden go into a seizure in your care. He's not going to all of a sudden pass out in your care as long as you are giving him his insulin. So just keep in mind that you don't need to be in a panic mode when he is suddenly in your care. Trevor and I will always pack his food. We will always tell you exactly the number that you need to dial on the insulin pen that I will show you, so that all of the carbs and all of the dials and the amount of insulin, really, if that's not your job, and we don't expect you to understand it. It's taken us months and months and months to understand it. So this is just a video that you can watch as many times as you need. I'm going to actually use a peach, acting like I'm injecting it with Landon. I'm also going to make a video when I'm actually doing it live with Landon. He does it really well, and you shouldn't have a problem. So I have a script. I look retarded, I know, but just before I keep continuing, this is going to be on YouTube public, so anyone that's watching Landon can watch it. Keep in mind, if you are not within our realm of family and friends and were recommended this video personally by Trevor or I, please stop watching this video. It's not a medical video. I'm not trying to give comfort or medical advice to anyone with a child with type 1. I'm not qualified for that. So please just stop watching. It's not for you. But Landon, basically with diabetes, he cannot make insulin on his own and can't survive without it. He needs to have the correct amount based on the number of carbs he eats. So you don't need to worry about Landon's diabetes unless he is eating. What you're going to do is you're going to first, before Landon eats, which is normally, obviously, breakfast, afternoon, and dinner, you're going to check his blood sugar. If you only have Landon during lunchtime, you only need to do all of this one time. If you're watching him breakfast and lunch, obviously you're going to need to do this 2 times. So his snacks are not needed to, you don't need to check his blood sugar for his snacks, and you're not going to give him insulin for his snacks. You're only going to give Landon insulin for breakfast, lunch, and dinner. However, that is because his snacks are either going to be carb-free or limited to only 10 carbs. Again, we'll be packing his snacks for you. But if for any reason you feel like he's hungry or needs something to eat, there's what's called carb-free foods. These include almost all meats, cheeses, pickles. If you look at the nutrition label where it says carbs, it'll tell you how many carbs are in all your food products. If it says 0, you can give that to Landon at any time. It'll never affect his blood sugar. So keep that in mind. We give him, for example, there are sugar-free popsicles that have 4 carbs. That's also pretty safe. You could probably give that to him as a snack too. Again, you're never going to give Landon any insulin or check his blood sugar with a snack. This is only breakfast, lunch, and dinner. The first thing you're going to do is you're going to check his blood sugar. Let's say it's time for lunch and you're watching Landon. Before he eats absolutely anything, you need to get out this Freestyle Light. This is his blood glucose monitor. This is going to tell you what his blood sugar is. His normal range and ideal range is from 80 to 200. But keep in mind, you're going to get lows and highs. We get it every day. For example, for breakfast today, before breakfast, he was at 99. That's perfect. But then after breakfast, he had 30 carbs, and then at lunch, I tested and he was at 220. Again, we don't panic at highs and lows. He's not going to go into a seizure with a high or a low. As a matter of fact, when we took him to the ER before we found out he was 600, he wasn't seizuring or anything, and he was fine within 2 hours of them treating him with insulin. So don't panic. If for any reason the number is above 200 or below 80, you will need to adjust these instructions. We will take care of the above 200 and below 80 in a different video. So this is going to tell you exactly what his blood sugar is. What you're going to do is you're going to get out one of these, I don't know what they're called, but you're going to get out one of these tabs, glucose tabs, who knows what they're called. But they have a little butterfly on them. I'm sure Trevor knows exactly what they're called. But this is a little butterfly on them. You are going to actually take this, and there's a yellow tab insert. The smaller part is going to go out. The larger part of the tab is going to go into this, and you're just going to push this down, and you'll see all these crazy numbers. It's just waiting for the blood. You'll see that little drop of blood blinking? That means it's ready to take Landon's blood. So what you're going to do is, this is a finger pricker. It doesn't do anything to Landon except give him a little prick. So what you're going to do is you're just going to pull back, make sure the needle is always back, and this really doesn't hurt Landon. Don't be intimidated. A lot of times he'll just literally hold you out his finger for you. He's not gonna normally cry or be scared. He's like an awesome pro at this. He'll just sit there. If you're intimidated, a good idea is to let him be watching cartoons. I know, don't let kids watch TV, but oh well. We do, because we're on survival mode. So if you need to turn on Elmo, Sesame Street's good, he's good to go. And he'll be watching that and barely paying attention to you. Same thing goes when you're injecting insulin. If you have a distraction for him while you're doing it, that works great for me. If you have other kids playing, that would work probably better than TV. But hey, if you need to resort to TV, go for it. So what you're gonna do is you're just going to prick any one of Landon's fingers. Where you want to prick it is, you don't want to ever prick it on this side, on the front or on the back. It's the side of the fingers that you prick. So which finger you prick, you want to alternate. So if you do have them for breakfast and lunch, just don't do the same finger. But what you're going to do is you're just going to kind of pinch it. You're going to put this, just pull it back, and you're going to line it up. Oh my God, I just pricked myself, dang it. And then you're going to get a little tiny bit of blood. Do you see that? Little tiny bit. And then what you would do, I'm going to mess up his numbers, so I'm not going to actually touch it. But you would take this little prick of blood, and you would actually line it up with that. It'll go beep, and it'll give you a number. Okay? But it's really like that simple. So when you pushed it back, what you're doing is you're pushing this gray button, and that just pulls it forward. You can put his side of his finger straight right flat with it, and just hit this gray button, just like I just did, and prick myself. Whatever. Okay, so that's gonna show you how to use the blood glucose and this pricker. This is not the insulin pen. This just pricks him. You probably want to be wearing gloves, because it is dealing with blood and your blood, to protect yourself and Landon, obviously, whenever you're using blood. So, use disposable gloves. Obviously, if you're family, we're probably not going to worry about it. But if you're a babysitter or a friend and you're not comfortable, then I would recommend you wearing gloves to protect yourself. You should always do that no matter who it is, and it protects Landon too. So that's kind of a nice thing to remember. But that is how you test his blood. It'll read his number. Whatever this number says, is going to determine how much insulin you're going to dial in his insulin pen. So after you've taken out a tab and done this, and you have his number, you will text Trevor or myself, whoever we tell you to, and we will immediately respond back what to set the dial to. You will not do this on your own. So don't worry about that, any of that. This is his insulin pen. We are currently giving Landon his insulin before he eats. If you forget and he started eating, don't panic. Give it to him. Even if you gave it to him at the end of the meal, he will be fine. But we're starting to give it to him before his meals so that the insulin is acting while he eats. Because what happens is, as soon as Landon eats, because his body does not make insulin in the pancreas at all, everything he eats goes straight to his bloodstream. without insulin. Now, when you eat that, the blood sugar will go into a cell that goes in the right place. Landon's will go into his bloodstream and not into the cells without insulin. So the sooner you get that in there, the sooner that blood sugar will go straight to the cells. But again, as long as he's getting it, even when he's done eating, he'd be fine. But keep in mind, try to give it to him before. The problem with Landon, because he's 2, it's hard to say how much he's going to eat. And this is kind of makes it a little bit tricky. But that trickiness, you will leave that up to Trevor or myself. You will just text us what he ate. You're going to count his carbs. We have his whole meal planned out, and we'll tell you exactly how much carbs are in everything. But he might not feel like eating his apples that day. And say the apples have 5 carbs in them and he didn't eat them. You will subtract that from the number of carbs we gave you. One thing that works for Landon is he pretty much always has to have at least 30 carbs at every meal. This is tricky, meaning he can't have 15 carbs for breakfast and get away with it. He cannot, because we are adjusting his insulin to 30 or more carbs always. We can't go lower than 1 on the insulin dial. So he has to have at least 30. So what happens if Landon's being cranky? He doesn't want to eat his apples, or he doesn't want to eat his chips. You're just going to subtract that and then text us. If he did not want to eat his apples and they were 5 carbs and he's at 25 carbs that he ate. So what you're going to do then is we'll probably tell you, you know what? He works great with baby food. Just shove it in his mouth. So you're going to we'll tell you to grab, we'll have a baby food backup, like the apples in the baby food puree, back up in the bag that has 5 carbs in it. We're going to tell you, feed him that and just spoon feed it to him. You know, distract him and spoon feed it and get it in. If you absolutely have to, you have juice. We all have backup carbs that he will take no matter what. And you do need to make sure he takes them even if he's cranky. Again, if you need to distract him while you're feeding him his baby food, any way you can distract him. If you have another kid that can do a dance, if you need to put on Elmo, whatever it is that you need to do, what's most important is you get in the number of carbs that he needs. He needs at least 30. But then what you are going to do is you're going to get out this insulin. This is insulin pen. It comes in, it'll be in this container. You're going to take this out. This is his insulin. Landon also has nighttime insulin, but you're never going to need to worry about that. If you did and you're keeping him overnight, we will show that to you individually. But this is the insulin pen. You're going to open it. Doesn't have a needle on it yet. You're going to put the needle on it. You'll see it has this insulin pen. It stays like this. You're never going to need to fill it. It'll have plenty in there for you. There's also a dial on the insulin pen right here. This allows you to dial it to the correct insulin. Right now, we are pretty much sticking with 1. If his numbers are high, or he eats a lot of carbs, which he can do, then oftentimes we'll give him 1.5. Again, you're not going to guess this. You're going to text Trevor or I. We're going to tell you how much. As a backup, we will give you a cheat sheet. Just say in an emergency situation that you can't get a hold of us, but we don't want you to use that. We want you to text us. We'll text you right back. We know when he's eating and we'll be expecting it. And obviously one of us, you will be a contact person. The second person will be the emergency. You shouldn't have a problem talking with any one of us. My sister, Jill, is a nurse. I'm planning on training her. She will be a 3rd backup call. And while I'm mentioning that, if for any reason something tragic happened and Trevor and I were both unable to care for Landon or pick him up, you will need to contact my sister, Jill, and she will know and be trained on how to take care of Landon, and she will come and pick him up until we could pick him up in an emergency situation. If you were still in his care at dinner time and you didn't know what to do, you're going to take him to the ER. You're going to say, I am suddenly in the care of a child who I know has type 1. I have no idea what to do. They'll take over for you. They'll know what to do. They're very used to taking care of kids with type 1. So don't worry about that. That's all you're going to do. If something happened with us and you're going to call Jill, you'll have her number and she will come and get him as soon as she can. But how you're going to give him the insulin is first you're going to text us and we're going to say what to move the dial to, 1, 1.5, 2, whatever that may be. And the numbers are here. See, There's 0. That little arrow, that's 0.5. That's 1. We don't ever give him 0.5 though. That's 1.5, and that's 2. We have only used 1 and 1.5 for Landon. Normally you're gonna use 1. Occasionally it is 1.5 and he needs a little more. Like today for lunch he was 220. Even though I had 30 carbs for lunch, I counted for whatever reason he was 220. That's diabetes, it's not you. You didn't do anything wrong. Don't feel like you ever did anything wrong if he's high or if he's low. It's happened to me all day, every day. It's just diabetes. You're totally fine. So, you know, just keep that in mind. But what you first do is you do a practice shot with these every single time. So every single time before you do anything, you're gonna dial it to 2. This is a practice shot. That 2 does not mean, that is not how much insulin you're giving Landon. This is 2 for a practice shot only. Then you're gonna take a needle. Sorry, this video's too long. You are going to take a needle that looks like this. It has a blue cap on it and it's white. You're gonna peel off the purple. It looks like this. Be careful not to bend that needle. And you are going to take an alcohol swab. We'll provide these for you. Just rip open the alcohol swab. Take out the small swab. I don't know why they want you to do this, but we do it, what they say. You wipe the alcohol swab on the tip to disinfect it, I guess, like that. And let it air out a little bit. Then you're just going to put the tip on here, just kind of line them up. Doesn't really matter how, just line it up. I've been it before, screwing up, don't worry about it. If you do bend it for any reason, and you'll know because it'll be bent. If it's bent, you absolutely do not use it. You need to take it off, and I'll show you how to take them off, and you'll just get a new needle. Do not ever insert a bent needle into Landon. Okay, so then you're going to pull this off, and there is a purple cap protecting your needle. It won't bend on a normal basis. I'm just saying if it did, I happened to do it in the hospital. They said that's rare. I'm like, oh, of course it happens to me. Okay, so this right here is the needle. Put it on my white shirt so you can see it. See that needle? So that is the needle. So you're gonna do a practice shot. I dialed it to 2. Do it before or after you put the needle on, doesn't matter. It's upside down. See that 2? Hope it's not backwards. Squirt it in the air. I don't know if you'll really be able to see this. Did you see that? It squirted up. It looked like a stream of water. That's making sure the insulin is coming out of the needle tip. Perfect. Now you're ready to give him the dose we told you. So you texted us how many carbs he actually ate. If he ate the exact number of carbs that we gave him for lunch, he ate all of it, you don't need to call us because then we will have written down what the number is if he ate all of it. You really only need to call us if on this meter, it was above 200, or on this meter, it was below 80. You need to call us no matter what. But if his number was between 80 and 200, he eats all of his carbs, then he followed everything like he should, then the number is written down on the card with his lunch. But you can text us. That's more from Miss Nikki, really, because she'll probably get pretty good at it. But you don't need to call us every time if he ate all of his carbs and his blood sugar right before lunch was great. Because he'll only probably need 1, I'm guessing. But right here, you're gonna dial it. Let's say Landon needed 1. So you're gonna move it to 1. Make sure it's at the right number. There's half, that's 1.5, and that's 2. We've never gone beyond 2, like I said, so. Make sure that is correct. You might, if you have another adult and they could verify that actually is 1, that's a good idea. Now you're ready to give him a shot. I will have a live video for that later of me giving Landon a shot. Now these, he doesn't always like. He's getting way better at it. Some days he could care less. Some days he's going to give you a fight. Hopefully by the time he's in permanent care, like with Miss Nikki, he's given up. He's already gotten a lot better at it. I hope he's a pro at it. He may or may not be. Here's the thing. If he's screaming and crying, it might bother you to feel like you're hurting him with a needle. What I always say to myself is I'm helping him. It's just like you're giving your kid an immunization. It hurts, but it's for their best. So even if he's screaming and you have to hold him down, it is what it is. I hate to do it myself, but it is what it is. I'll demonstrate it. I'll show you how I do it. He's pretty cool about it. I'm going to right now demonstrate. You really want to use an orange, but do I have an orange? No. So we're using a peach. So I have this peach here. So this is what we practiced using in the hospital. And for, you know, I don't even think about giving Landon shots that much anymore, about it being intimidating. But when I was in the hospital, man, I must have practiced on an orange maybe 20 times before I'd even touch Landon. So don't feel bad if you do not feel confident to do it. You will not be watching Landon until we know you're confident doing it. We're not gonna just hand our kid over and say, make sure you watch the video. We are going to have done this in front of you quite a few times before you would be able to care for Landon. So you have seen this live. We will watch you doing it, maybe not just once, but quite a few times before we're gonna just leave Landon with you. So just keep that in mind. This video is just to help you watch it a couple times to help you, but you're not gonna be left within like, oh, we won't leave you with him if you feel that way. So what you're gonna do is this has to be at a 90-degree angle. So this is not 90-degree angle. A 90-degree angle is right angle, okay? So you want a right angle. I would say for you guys, just always do his thigh. We can do the back of his arm. We can do his butt. But for you guys, just stick with the thigh. The top part of the thigh, not the bottom. So say this is his thigh. You're gonna pinch his skin a little bit, going in at a right angle. First, do not press the top yet. I just inserted it. Let me do that again. So here's your EpiPen, and here's Landon's thigh. You've pinched it, a good part of his fat. Do not, once you press this will press the insulin into Landon. You need to insert the needle before you press this button. So 90-degree, put it in, click, count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Lift up the button. I pinch his skin and slowly lift up. And you're done. And that's it. Very rarely he'll bleed a little bit. Most of the time he's not going to. If he happens to bleed a little bit, just have a tissue handy. And if you press on it, it's not gonna be gushing blood, just do a little dot. Just press on it, he'll be fine. Once you take this out of him, Landon's good to go. He could care less. He's like, bye, see ya. Back to playing. So what you're gonna do is just make sure after you give it to him that you know that went into him when that dial says 0. Okay? You can rewind this and watch it as many times as you need. Then when you're gonna need to take this needle off. Obviously, I need to take this needle off too. But you're just gonna take the cap, the original cap, put it on here, click it, turn this part of it, lift it, there's your needle. Set it down, put the cap on this before you do anything. Click it and put the pen back in the box so it's ready to go. Please keep all of your supplies organized and make sure that they don't get lost and you know where you put them. Believe me, Trevor's told me this many times. So once you have this needle, these needles should not go in the regular garbage. So we'll probably give you a plastic container to put them in, to throw them out, and we'll take care of them. But that's it. So basically, Landon's gonna be healthy and normal. He can run, he can play like a normal boy. There's nothing extra besides his meal times that you need to monitor him for. Sometimes, though, if you are worried if he's acting super cranky or just not himself, chances are his blood sugars could be off. And if that's the case and he's acting overly cranky and you just don't get it, you can check his blood sugar at any time. It doesn't hurt him. You can check his blood sugar. Now, we don't want you overdoing it because we don't want his fingers pricked that much. But as a babysitter, if you are at any time worried, this is not insulin. It's just pricking his finger. It's not changing his blood sugar in any way, you can use this monitor and this pricker, and you can check his number at any time. And then text us the number if you're worried. He's acting weird, text us. If it's not between 80 and 200, you were right. His blood sugar's too low, too high. We might say don't do anything. You know, it was right after a meal. After eating, his number is probably going to be above 200 if you tested it like 20 minutes later. If it's below a meal, you know, before a meal or something, and his number is 70, we're going to say give him an ounce of apple juice. So if numbers are below 80, you give him sugar in the form of apple juice. We give him 1 to 2 ounces. We'll tell you what to do. If his numbers are high, above 200, then he needs insulin to bring it down. So low, give him sugar, like apple juice. High, you want to do not feed him anything if he's high. Don't give him any juice. Don't give him anything but water or a no carb food like meat or cheese, because we can't have his numbers keep climbing. And then when you text us, we'll let you know if he needs some insulin to bring it down. Sometimes we'll say don't do anything maybe if it's at 220, or like just leave it alone. It'll probably come down before dinner. So we'll adjust that. One extra thing is if Landon is exercising a lot and playing a lot, his blood sugar will probably go down. Now this usually isn't too severe, but one day I took him over to the park and, you know, he met a friend and we were just playing. It was going crazy, didn't even think about it. And I got home and I checked him and he was 50. So I realized my mistake. I should have given him a 5-carb snack, realizing he was going to be exercising. But again, if that does happen, you're not going to panic. All I did was I gave him 2 ounces of apple juice. You're going to check 15 minutes later. So if he had a low number, he did at 50. I gave him 2 ounces. I waited 15 minutes and I checked him again. Normally his number is going to be above 80 and you're fine to proceed as normal. At the day that I checked it, actually his number was still low. And so I needed to give him another ounce of apple juice. So, you know, you just either give him juice or insulin at meal times and, you know, we'll take care of all of it. Other than when he eats though, besides those exceptions, breakfast, lunch, and dinner. If you're not dealing with a meal, you're not dealing with any of this. If you're dealing with a meal, you have to be willing to give Landon insulin. If you were uncomfortable, even if you thought you were, and then you're watching Landon and you thought you were good to go, and then you are just super uncomfortable and super nervous, call us. We're not going to be judgmental in any way. Just call us, we'll come pick him up. We will take care of him. We're used to taking care of him. We don't want you taking care of him if you're nervous, but we certainly appreciate everyone that cares for him, that can manage Landon. And I think you guys all can, because Lord knows we can. So you'll get there and we'll get there, and we just couldn't do it without you. So thank you. This is super long. I hope you don't watch it all in one big moment. I was thinking a 10-minute video.